SARC Talk. SARC is a nonprofit cancer research organization that develops and manages clinical research trials in pediatric and adult sarcomas. SARC Talk is a podcast to discuss activities of SARC, interview sarcoma research leaders, and review scientific initiatives in the sarcoma field.
Welcome to SARC Talk, episode 33. My name is Scott Okuno, a medical oncologist at Mayo Clinic and Chief Medical Officer of SARC. At SARC Talk, we interview interesting people who are connected to sarcoma, where we can all share and spread the knowledge about sarcoma. Today, our guest on SARC Talk is Dr. Elsa Nisswandt Keeler. She's a retired pediatrician and a chondrosarcoma survivor. She's active in advocacy and supports Rein in Sarcoma as a volunteer for the Educational Committee and Red Flags, and is a member of our SARC Research Advocacy Committee. Please welcome Dr. Keeler.
Thank you, Dr. Okuno. I'm really excited to be here and to have this conversation with you.
Absolutely. Well, it's good for us to connect here, and it's fun to hear, at least as we are all preparing in preparation for the SARC Talk, to read a lot about you and know more about you. And I just hope that this can be shared too with our audience today. So maybe you can share with the audience how you first decided in medicine and how you decided a career in pediatrics. I know you're not an oncologist, but we'll get to the next part. But how did you get involved with in that pathway?
Well, I think like most people or many people, I should say, who enter medicine, I was influenced by a healthcare professional who took care of me. And it happened actually at the Mayo Clinic in Rochester in 1978. I was recovering from a minor surgery, and full circle, we may talk about that later, but I needed some physical therapy. And I met with this physical therapist over about 3 days. And I went home. I was about 1979, so about 17. And I said, that's what I'm going to do with my life. I'm going to be a physical therapist. And went through my early years of undergrad, and my father, who was a physician, and I had a sibling or two in medical school at the time. They are in the minority. I have a very large family, so physicians are in the minority, but there was a little influence there. And I think Dad asked me driving somewhere if I wouldn't think about maybe physiatry, and so just got my wheels turning. So I applied to medical school. I'm an experiential person. I'm not driven by a goal. I loved my primary care rotations and settled in on pediatrics after just a joyful and heart-wrenching rotation with people that were so dedicated to the care of children. And that's what solidified the path for me. And then pursued residency, stayed on for a year as a chief resident, and then joined a suburban practice near my home because I had a 9-month-old baby at the time. And I said, well, this is where I need to be, closer to home. And I never left that practice for 27 years, surrounded by some wonderful people. And so that was my foray into pediatrics. So.
Well, that's interesting because it sounded like you started as a physical therapist wannabe, and all of a sudden you went to medical school. So clearly there must have been a change there.
Well, yes, yes. I think the message that I was hearing is, and I want to be careful with this because through my career, my closest colleagues in the field of pediatrics have been physical therapists, speech and language therapists, and occupational therapists. So understanding this collection, but I think the message was, this is possible for you. Okay. I and that I could see myself in that role. You can do this, and the people around me, family and professors, said this is possible, and I had a love of learning. I think that was the other part, that I wasn't afraid of that, you know, naively, the education that was involved.
Yeah. Well, as you bring up the importance of being a physician as part of a team, and in order you to be successful as a pediatrician, you needed the resources around you, because our time, our expertise is not in everything.
Mhm,
Everybody else has expertise, and that's same thing. We rely on sarcoma
mhm,
because it's a team approach, because yes, you need the right diagnosis, pathology, the right imaging, radiology, you need the right procedure, surgery, you need the right medical oncologist, pediatric hematologist, oncologist, you need the right physical therapist, occupational therapist to get through life after the things that we do. So it all ties in together. So I think all of us understand it, and your path was pediatrics. And what's interesting in our world today, there's very few of us that have spent a career at one place.
mhm,
27 years in your practice.
mhm,
Now, I've been at Mayo Clinic in my role too, coming on 30 years, and that's rare. But at
mhm.
Mayo Clinic and some of these practices, 70, 80% never leave.
Yeah.
Okay. Because of the values that we all have. And we appreciate, as we would say, your commitment to the pediatric cause out in the suburbs. Now, you spent a lot of time in Minnesota. Okay. You're
Mhm.
probably from Minnesota, I gather. You went to Duluth for undergrad biology. You then went to the University of Minnesota Medical School. Then you did your pediatrics. Um, and then all of a sudden, 24 years later, you decided you want to do a master's in public health, also at the university. So maybe can you tell us your pathway to stay within the system, and then your pathway to get to the MPH, and why at that point in your career you thought MPH was the thing you needed?
Yes. Well, simply, my undergraduate I was the fifth of seven children born within 10 years. And um, the college that was available to us was near to our home. Okay.
Yes.
And University of Minnesota Duluth is a fantastic institution. I had a top rate education there. I am a Minnesotan. My accent will get thicker as our interview goes on, uh, um, and yeah, the I believe, and we have four children. I've told them this all the way along. It is not the institution that makes you. You are the person going to an institution. And it's your job to learn as much as you can and surround yourself with the best people, the mentors, and so I, I didn't have a desire to go searching and being in a different place. So what brought me back there 24 years later, yes, um, as was that my career had shifted, and the first 10 years of any career is really spent in this very steep learning curve, and especially in primary care, gaining the clinical expertise. And I was surrounded by just some incredible mentors who were with me my whole career, who asked me questions at the very beginning when I was always asking them questions, but they'd come to me with questions. And little by little, I got involved with a few things that, how they come across your desk and you let it sit there for a while. And the first one was, it was an opportunity to participate in a medical home collaborative. So getting back to your comment about the team approach to sarcoma, we need multidisciplinary um, uh, folks involved in the care, whether it be the highest specialty care or the most comprehensive primary care. And so this collaborative involved experts that were leading us through practice improvement, and it also involved patients at the table. So this was in the early 2000s. So I had the opportunity to ask a parent of one of my patients who had special health needs, multiple needs, and we participated in this collaborative, and that led to other collaboratives, which led to connections to the community, the public health community. And then all of a sudden in about 2010, I was realizing, okay, I'm working with the Department of Health, the Department of Human Services, but where is my epidemiology background? Where's my biostatistics? Where's my Elsa? I think it's time to go back and learn a little more. So I applied to, was a really nice, somewhat distance, but also in-person learning. And it was also a time, because we are influenced by internal, I'll call them internal triggers, which are family, friends, environment, the winds, the tides, the spirit. And we had just had 3 of our children leave the nest and were in college. We only had 1 left. And it felt quite, there was a relief around home. And so I said, okay, this is a good time. And I went back, and it was a joy. It was a joy. It was incredibly challenging to be working full time and pursuing a master's, but met some wonderful people. I got leadership skills that I was not quite aware of, the depth of understanding what is involved in leadership. So I had more formal education in that. And it really shaped kind of the trajectory of the last 3 or 4 years of my career, which unfortunately came to an abrupt halt. But
Yeah.
but that, more on that later. But yeah.
Yeah.
So
Also what I'm hearing, and I think if anybody's been listening to these podcasts in the past, is that all of us are in a constant learning mode.
mhm,
And healthcare is changing. The knowledge that we need is changing. We need to continue to up our game because of opportunities. I don't know much about that. I need to get more skills. And even 10, 20 years into your practice, you have a mindset of still learning.
mhm,
In fact, that's the mindset that we don't know it all. Um, Somebody knows some of it, but no one knows it all. And we're just going to continue to work and evolve.
mhm.
And it's great that you did manage. And I would say the word, when your kids leave, it's liberating. But then you got to say, now I got to do my real job.
Yeah.
Plus, I got to do my, postgraduate MPH. But it's set a trajectory that will change. So I think anybody listening would say, yep, we're not done when we're done.
No.
It's always there.
Hmm.
To that
So true.
change in trajectory,
Hmm.
there was a change in your life that brought you to us. And maybe if you're comfortable telling our group here a little bit of your story of your chondrosarcoma, and I think it'll be helpful because this was not something anybody planned, but maybe if you're willing to share.
Um, yeah. Yes. So in 2019, January of 2019, um, I was diagnosed with dedifferentiated chondrosarcoma. And unbeknownst to me, so back in 1978, Dr. Frank Sim, who you I'm sure are aware of, and Dr. Sim performed a biopsy on my right femur, and at that time, the question was for my parents, does my child have cancer or not? And the answer was no. And I was told I had a benign tumor. And I went on and lived my life. And I'm very thankful that I didn't know then what I know now. But flash forward to about 2015, I had pretty much lifelong difficulty with my right leg, and I knew I had these benign tumors, and periodically things would happen. I'd have an X-ray, but I ended up seeing a colleague at the University of Minnesota and Health Partners, who is an orthopedic oncologist, who because an MRI was suspicious, and he looked at everything, and he said, well, Elsa, you have Olier's disease. And I did a quick lit search and realized that, this is a condition that where an individual has multiple enchondromas or bony tumors. And the importance of that for me was that there was, somewhere maybe around a 30 to 40%, depending on the literature, chance of malignant transformation over a person's lifetime. So for those last 3+ years before my diagnosis, I did live with that. And I had time to reflect on as a patient. So I'm speaking as a patient, but also a physician, and I think this is really important because I eventually got involved in some policy work on screening in these conditions, which I was able to add my voice as a patient advocate. So I knew I had this potential. And in the last probably 6 months before my diagnosis, I had a little nagging thought in the back of my mind. Pain was my driving force, and circumstances happened, but ultimately January 3rd, 2019, we knew I had chondrosarcoma. And then in the 4 weeks of the process of evaluating some other issues and getting to surgery, I unfortunately had a rather emergent, instead of an internal prosthesis, had to undergo above the knee amputation. And then 3 days after that, discovered the tiny millimeter lesions that were there on January 5th were now 2.5 centimeter, multiple metastases. So it was a dark time. It was the valley of the shadow, and yet surrounded by as we all look first to those who love us, and then we look to our scientists, and the scientists came through for me. I have to say, the oncologists, I saw them all. I saw the whole team. I don't know if I ever met the pathologist involved, but saw the whole team, and I was very fortunate, beyond fortunate, that so I received chemotherapy. I was offered that, and there was no question. There was no question, and so I had the standard guidelines protocol for osteosarcoma for this sort of situation, and within a number of cycles, had complete resolution of all my mets. And that still just caused me such pause. I mean, I'm going to say this a few times during our conversation. The patient is an N of one. Okay. That's how we see ourselves, the N of one. We can read the stats. And so unfortunately, you read the stats and every review article I read, I swear all the authors combined efforts, they use the term dismal. Dedifferentiated chondrosarcoma is a dismal diagnosis. I didn't appreciate that, but so I was, and then and I'm gonna thank SARC study. I think it was 28. I had read there was, I think, one patient with dedifferentiated chondrosarcoma who responded to checkpoint inhibitor, and again, you may look at the big study and say different things, but with an N of one, I said, that there might be hope there, and my oncologist suggested adjuvant pembrolizumab, and so I was treated with that for quite a period of time. Had a few side effects, but flash forward 6.5 years, I have not had a recurrence.
Elsa, thanks for sharing that story. And there's some things just to pause and think about. First of all, you have a very great team that took care of you, continues to take care of you. When you have a rare disease, and if you would have known that there was a malignant potential when you were in 2007, 8 with Frank Sim, what would it's hard to contemplate what your life changes would have been at that time. So fast forward to 2015, when you now know that you had Alliers and there is a malignant potential. 2015 to 2019 was always on the back, 4 years on the back of your mind. Just think about it in your formidable years as you were going through school, raising a family, getting engaged with your practice, how that would have overshadowed. And sometimes, just glad you didn't know, maybe. Okay. But we're in a world where everything is searchable,
Yes.
Googleable, and then you get so much information, and then you go into the dismal wording that you start to hear. And I think we have to kind of pause, and that's why, how do you get out of that mindset of, hey, I can chat this, I can Google it and find information about it?
Oh, that is a very good question. I think that I think surveillance is incredibly important. I think there's a responsibility of the team. Okay, the team, as in the medical team that surrounds the individual. So, in retrospect, if I was starting today, if it was my child, okay, my teenager who has this lesion, and we're going to follow this out, I think it takes it's more than the medical protocol of MRI every 5 years followed by X number. It's so much more than that. There has to be a component, of the, I'm going to say, the mental health perspective. So we are, I'm a whole person. I'm a person with a mind, body, spirit, soul. And when I see patients, I've seen my own patients, or I see fellow sarcoma survivors who are facing recurrence. Recurrence is similar in that way. There is an onus on the individual, but also on the, I'm going to say, the team, the organization, the medical society to balance it, um, balance the risk. Okay.
Well, that is true. And um, I'll share. My brother sent me a note saying, "Gosh, AI is going to put you out of business. It'll tell you everything
Mhm.
you need to know." And I'm thinking like, "Hey, there's more than just knowing what to do. It's how do you display that? How do you show care? How do you help someone walk through that journey together?" AI just won't have that. And we're very fortunate that you've been set up in your pediatric work and the work you did with the medical home, your MPH to be an advocate. So let's just step back here a second.
Okay.
Wearing your physician hat and as an advocate in health policy changes, and then maybe you can also share on a personal level what you had to do regarding when your prosthesis wore out
Right.
and you couldn't get a replacement because you were too active. Okay, so
Yes.
maybe
Yeah.
you can show on both ends of that part. Yeah.
Yeah. Yeah. Oh, yeah. Thank you. And actually, I think, when I think of the evolution of my advocacy, even just in the last 7 years. So, I started with my diagnosis and I'm a physician. So I'm a physician patient, but I had to put 100% of my energy into being a patient,
Yeah,
100% for about
absolutely.
2 years.
You
Yep,
had to focus on that. Yeah.
focus on that and my family. Okay. Because we are a team. That was the team. Um, so then I started thinking about, okay, you have this career, Elsa, you have this career, you have this knowledge base, you have this expertise in advocacy. Pediatrics was, you know, not 100%, but, but vastly about, about advocating for the needs of our patients who have no voice at the table or very little voice at the table. So um, I had a great understanding about digesting information and being able to share it in a way that could affect change. And so I started to use that in advocacy. And also as this physician patient, which is not unusual. There are so many. You can go to Barnes and Noble and read many, many books about physician patients, and I have. And I was not only a person with cancer, but I was also a person with limb loss. So that is a whole nother world, whole nother world. I think I want to say 2 million. No, I can't think of the number of amputations per year in the U.S. Um, for folks with cancer, it's only 1% of amputations are due to cancer. So we're a small group, but within that group, the majority of them are going to be folks affected by bone sarcomas, really. So it was I started to do advocacy as a mentor, a peer mentor um, around limb loss, and I would be paired up with folks who were facing cancer, and facing limb loss because of their cancer. And at the same time, it's like getting back on a bicycle. Not a bicycle with a prosthetic leg, for me at least, but I was about 3 years into it all, and my leg, my prosthesis, died or stopped working. And I had switched insurance because I had retired by then, so I was under my husband's plan. And the first time around, I had a pretty special leg. It worked pretty well. It wasn't completely waterproof, and I'm a northern Minnesotan, okay, by history. So I hike in the woods, I canoe, I portage, I walk in water, and so we decided this time around that I would be prescribed a microprocessor prosthesis that actually could do those things. Could be waterproof. I could use to do activities of daily living, like bathing and showering. I could actually run across the yard with my then 2-year-old grandson. I
Mm.
hadn't run. I hadn't run since 2018. Not because my physical body couldn't do it, but because I didn't have the prosthesis that would allow it. And then my insurance denied that coverage. They said it wasn't a standard model, and I didn't meet it didn't meet their qualifications of the minimal amount, and that caused me to question actually worthiness, which is a question that I think a lot of patients ask. Am I worthy? Am I worthy? Because in order to advocate for something, you have to believe that you are worthy of it. Okay. And that is a message I think maybe to the patient population. But so flash forward, I kind of was involved in the limb loss community, and there were two things that happened. One was a bill had been working its way through the Minnesota legislature for about 10 years. And there was a national movement that came about called So Everybody Can Move. And So Everybody Can Move, you can Google it and search it. And they've been equipping states with the resources to move this legislation through, which will allow for parity in prescribing for prosthetic and orthotic equipment. So the example I give is that when an individual needs a new knee or a new hip, hip replacement, knee replacement, the orthopedic surgeon picks the state-of-the-art prosthesis that is functional for the person, meets their needs, and it's covered. There's no questions asked. When an individual with limb loss asks for a prosthetic to meet their activity needs, it is denied. So that's it in a nutshell. And they were at the legislature. They had sort of a meet your senator day. I went down and sat in the office with my local senator. I had a conversation. Speak from the heart. Don't speak about what you don't know about. So that's an advocacy key, and that led to testifying before the House. I think it was the House Finance Committee, one of the committees. It did help that I was also testifying next to an 8-year-old boy who had his running blade out. So I used that. And I'll tell you what I told them. I said that that in my career, I told children that their job is to run and jump and play every day. That's their job. So physical activity, which leads to lifelong health. And the only reason a child with limb loss can't get up and run across the field is because they don't have the device that allows it. Their body is capable. They need the device. And it passed. The law passed. It is law in Minnesota that commercial health plans cover prosthetic devices for physical activity. And it is exciting. So long story, but how do you get to that kind of advocacy? I had done it a few times before. The American Academy of Pediatrics is an organization that is all about advocating for children. So our Minnesota chapter has been at the legislature for years and years. I'd go today at the Capitol. That's a great way to start. Day at the Capitol. You're in it with a group of people. You don't have to stand out. You can walk into your representative's office, say hello to them. There's typically a couple of bills that affect, your cause. And so that I had been doing for years. I had testified in committee one other time. And then I watched a lot of committee hearings, and I watched people testify, and I listened to what what is compelling? What is compelling? But it is a little bit daunting. Yeah. Anyway, that's the
Well,
story.
I'm smiling on the inside because who else better to advocate for prosthesis than someone who actually has studied and looked at it in her whole career as a pediatrician, advocating and understanding legislative process. So, to your point, we're blessed, and no one would want this on you, but
No,
you were prepared for this. I mean, think about it. Your whole career was based on this, not that defining moment, but other defining moments as well. And there are a couple defining moments we just want to get into as well. And
sure.
I know you're involved with Rein and Sarcoma,
Yes,
and we've talked to several people from that organization as well. And maybe for those that are listening here, can you share a little bit about what Rein and Sarcoma is and what role you play as advocacy and education and the red flags?
sure. Rein and Sarcoma is Minnesota-based, nationally known nonprofit, and is dedicated to patients and families affected by sarcoma, funding research to understand early diagnosis and cure, and educate um, patients and families, educate the public, and educate the medical community about sarcoma. So that's it in a nutshell. Um, I had been aware of it during my career, so I had. And so when I was diagnosed, I looked them up and um, spent that first year or so focusing on my own health, and then took advantage of their patient support, coffee time, and then kind of made my way in and said, well, I do have some expertise. Maybe I could help out somewhere. And uh, um, and so the education committee is where I landed, and I do chair that. So in keeping of the overarching mission, um, we have patient guidelines that I think we went through the eighth and ninth edition revisions over the last 5 years. So I was heavily involved in that, and that also involved mentoring, which is something that is really near and dear to my heart. I mentored my whole career, students, from students interested in medicine to medical students, nursing students, advanced practice students. So um, um, I mentored students as we worked through that editing and understanding how to provide sound advice that isn't going to become outdated next week, and where to give people resources. Um, we organized a presence for the public and healthcare professionals. So making sure Rein and Sarcoma has a presence at gatherings. So gatherings of everything from athletic trainers to school nurses to family physicians, and really spreading the word that way. Um, and then I think a big part of my work has been working with the sarcoma scholars, who you are very familiar with. I know you are.
Hmm.
Yes. So, yeah,
So, well, first of all, again, those that are listening, if you ever want to engage with great and you have skills and want to get involved, patient uh, family advocacy groups in sarcoma are present. Rein in sarcoma is a pan. It's not specific to histology.
mhm,
And I would just reiterate, it's a great organization. We have great leaders and great people that are committed to this. Those that are listening to the Sarcoma Coalition is part of, we are
yes,
is a member
mm,
too, and there are a lot of organizations. So if please reach our website there, Sarcoma Coalition for others, and Rein and Sarcoma is there as well. Out of that mentoring, there was a unique thing that I think will be important for an awareness. somewhere along the way, there was a thought that, hey, we need to get the word out about sarcoma. What is the knowledge base of sarcoma? And in the great Minnesota fashion, the Minnesota State Fair, okay, for those that don't know, it is the event of the year is before we get to school, as we would say. And then you working with some scholars surveyed people at the state fair in 2015 and 2023 and kind of share kind of what you found because
Sure.
it's a very unique thing. Yeah.
Yeah, yeah. So this started before my involvement with Rein sarcoma, but um, the University of Minnesota has established a Driven to Discover research facility at the Great Minnesota Get Together, knowing that there's 2.5 million people that come to the Minnesota State Fair, and what are they thinking? Okay, so the opportunity for um, survey research was offered. And in 2015, the then medical student scholars that were sponsored by Rein and Sarcoma applied for a grant and conducted this survey, and I think surveyed 1,500 people. And if you take a step back, so what are the questions we want to know? Well, we're all trying to solve this question of delay in diagnosis. Why is a delay in diagnosis happening? I'm not to lay blame, but to ask questions. Okay, so the questions that were asked were, what is your threshold and timeline to get an evaluation if you had a lump or a bump, if it was painful or not painful, if it was this size or that. And so those were the kind of questions that were asked. And also, who would you see? Who would you see? So then that could inform, where do we need to focus our education? Okay, who would you see? And then to assess the general public knowledge, which is really important, as you and I know.
Yeah.
So, and then when I got involved with Rein and sarcoma, are actually a number of years of scholars. So one group of scholars decided to repeat the survey. They handed it off to the next group to analyze the data. And it might have even been a third group, or maybe it was that second group that then said, well, let's pull this together and let's publish it. Let's move forward. So very collaborative effort. And so the results of, I want to say over 2,000, maybe 2,500, somewhere in the 2000s combined, and very similar results over the 2 years, was that pain, and may not be a surprise, but pain is really a driving factor that leads people. That worries me a little bit because, as you and I know, sometimes sarcoma can be painless. So,
Yeah.
and that primary care providers are that first portal of entry, which leads us to understand from an education standpoint where we really need to focus our education, because as we can talk about red flags or not, but we know appropriate imaging is a pivotal appropriate imaging is a pivotal step for folks.
Absolutely.
Yes. And then overall awareness is low. Overall awareness is low, and it's not that much higher in people who are college or professionally educated in medicine.
Yeah.
Okay, that's sobering. That's sobering.
It is because we think that the more educated you are or have more education,
Mhm, mhm.
that you should be more aware of sarcoma, but that's not what you guys found.
No.
And then more importantly is if pain is the main trigger, that's a late problem
Yes.
generally. It can be
Yes.
painful, but it's late.
Mm-hmm.
And because of that, they seek care not with a sarcoma doctor. They seek care with an athletic person, a physical therapist, and or
Mhm,
primary care and or pediatrician. So then you all said, wow, we need to educate those people.
mhm.
And that's kind of what you said. And share a little bit about red flags then.
So, and the red flags, uh, I think I don't know all the history of the term per se, but understanding that there are some key factors that influence the likelihood of malignancy, and really point towards imaging. I mean, they're part of guidelines, so that those are, mass greater than 5 centimeters, deep to the fascia, um, painless or painful, could be growing, and I I, I think that um, it I want to say it came out of, now you can correct me, was it Sweden? uh
It was from Europe, and they had
Europe
the size of a golf ball made in that
also.
part. And I'll
Hmm.
just, for those that are watching, this is the red flag, 6 red flags. There's brochures out there too, and it, as Dr. Keeler said, these are the flags that should warrant that a lump and bump might need further evaluation.
Hmm.
And we're trying to get this to not just patients, but a lot of primary care healthcare providers. Go ahead.
Yes, no, absolutely. And I think, to your comment, I'm going to circle back to your brother's comment about AI. um, there there may be ways to harness our our EMR and our AI, and we know that.
Yeah, yeah.
There could be triggers that, now the data would have to be in, so we would have to, as clinicians, be able to document. Yes, but it could happen. It could happen.
It definitely could happen. My colleagues and I put a request in for that project as well, to
Oh,
scour the EMR to see if that we can find it. And I know your group has looked at triggers in the EMR to prompt people to do imaging based on things, and future comments we can do that.
yes.
I know our time is getting to
Mhm.
the end, but you're also a new member of the SARC Research Advocacy Council, and maybe you can share how you got involved with that and kind of what you think about that.
Uh, Yeah, so SARC was always on my radar, I think from the very beginning, because of the importance of sarcoma centers. So I knew that. I had the knowledge coming into it. I live in Minnesota. We actually have sarcoma centers in our backyard, and I was very fortunate that the person following me, the orthopedist, was part of a sarcoma center. So I entered before I even knew I had sarcoma.
Hmm.
Um, so that was incredibly important. And then, Scott, I just have to tell you, and this is not solicited, but it was your podcast that
Oh,
that I know. I'm sorry about that, but I started listening, and mainly because of, again, getting back to that, knowing my medical background. I said, okay, it's time to delve a little further and understand what these researchers are doing all over the country, understand the importance of this, and um, also for me to be able to speak credibly as an advocate in the support circles I'm in. So I am in support circles with other sarcoma survivors. And even though I am a fellow survivor, I also have the medical background. And sometimes I hear things that they give me pause, and I have to respect the experience, but I wonder about the perspective. So I realize before I speak, I need to become more knowledgeable. So that's that. Let's learn more. So I did participate in the CDRP, the congressionally directed. So that was a panel that was a little daunting, but reviewing research proposals. And then most recently, I heard about your steering committee to reevaluate the sarcoma centers or create a framework. And that appealed to me so much because I believe in what's framed, but I also believe in what's between the lines. So what's between the lines is the patient experience. But if there isn't a solid foundation of framework of these are the experts, this is the team that has been vetted, then that patient experience doesn't have a place to fall. Okay. So so it led me to thinking again, well, I could see myself there, and I want to learn. So I just made the call, and here I am.
Well, first of all, we love that you're engaged with sarcoma. We're enthusiastic that you're engaged with Rein and sarcoma, but we are doubling down on your engagement here at SARC as a Research Advocate Council too. So we are happy and blessed. And can you also, you did share that, hey, your first thing as advocacy is to know what you know.
Mhm.
And if you don't know, bone up on it, learn about it. So as we end, as we think about the messages that you want to end with, so the people that are listening, if you're driving and had a billboard,
Oh boy.
what would your billboard say as a final comment for Dr. Elsa Keeler?
Okay. So as a patient advocate who brings my own expertise to the table, and I want other people to think about, okay, what's in your toolbox? What's in your toolbox, and what can you learn? Someone told me very early in my sarcoma journey, Elsa, use your energy to do what brings you joy. Okay. So that's a little touch point for me. I say, this will bring me joy. It's not about me. It's about others. I have experience in it, but it's really about making the world a better place. So that's what I would say. Use your energy to do what brings you joy.
With that, we will end.
Okay.
Bring joy, use your energy to bring joy. What an inspiring story and continued story. And we
Yeah.
hope that we continue to learn from you too, Dr. Keeler, because this has been very insightful for me as we learn more about yourself and how your journey is here. And we look forward to continue work together through 2025 and beyond. So thank you.
Thank you. Thank you, Dr. Okuno, from my
Yeah,
heart.
pre-
Yes.
yeah, appreciate it.
Yep.
For those that are listening, SARC Talk is not performing. We have SARC Talk every month. If you have any comments or suggestions for future topics, please let us know. We look and review those. And otherwise, you guys have a great rest of the month.
Thank you for listening. Be sure to subscribe so you never miss an episode of SARC Talk. To find out more about SARC, please visit our website at sarctrials.org. To suggest a topic or for questions, please email us at sarctalk@sarctrials.org. Together, we can find a cure for all forms of sarcoma.